3 cases of whooping cough have been reported at 3 different schools in Lancaster County, including Warwick High School, according to the PA Department of Health. The districts have alerted all parents, but the bacterial illness can spread quickly if a student comes in contact with someone diagnosed. News 11's Sarah Veronis spoke with a local doctor earlier today. She joins us live at the super screen with more. Sarah?
Erica, pertussis, commonly known as whooping cough, is extremely contagious. It can, however, be tricky to detect early on. I spoke with Dr. Carrie Campanella from WellSpan Family Medicine to find out the signs and symptoms of whooping cough. And this happens in 3 stages. As you can see, stage 1 is the common cold. This is where sneezing, a runny nose, and a low fever, and this can last about 10 days. Stage 2, this is the most severe. This is when you'll have uncontrollable coughing spells, vomiting, extreme fatigue, and the last stage is gradual recovery. This is when coughing subsides. This can last about 10 days, and we talked to the doctor to find out more. Take a look. It's a cough that is hard to forget, and it happens if you catch pertussis, otherwise known as whooping cough.
Whooping cough is considered a highly contagious disease. Most children are vaccinated for pertussis if they receive the recommended vaccines. However, we also know that immunity to pertussis, even from the routine vaccine schedule, can wane, sometimes even by early adulthood.
This bacterial disease is on the rise here in Lancaster County. 3 cases have been reported and confirmed, including 1 at Warwick High School.
The cough from this illness is quite intense, and it's difficult to protect those around you when you're coughing so violently.
Warwick School District sent out a letter to all parents and say they are taking the proper measures to keep their students healthy.
You should stay out of public gatherings until your cough and respiratory secretions are under good control.
Recovery from the potentially deadly disease can take up to 3 months, but once diagnosed, an antibiotic may help.
The other major part of treatment is control of the cough, but the problem is there's really nothing that works.
It is, however, highly preventable when vaccinated, and many parents believe vaccinations are a non-negotiable.
To me, vaccinating your child from a preventable disease, I think, is the way to go.
In fact, the CDC reports that children who have been vaccinated are 8 times less likely to get infected. And the recent cases here are not something to take lightly.
From what I know, it absolutely does concern me, and especially having a little one and just, thinking about, I've heard it's highly contagious.
Now, doctors do say vaccinations are about 70% effective, and all children should receive their booster around the age of 11. They also say adults should get vaccinated. If concerned, you should contact your physician directly. Live at the super screen, Sarah Veronis, News 11.